Hi students, I am Dr. K. Gopala Kumar, working as an associate professor in the Department of Pharmacology, Sri Shanmuga College of Pharmacy. In previous class, we learned about the various routes of drug administration, which is um, parenteral route of drug administration and the enteral route of drug administration, majorly two types. We are well known about those two routes. Today we can move on the topical and other route of drug administration. This is the very important topic in the pharmacology subject. In the topical route of drug administration, the drug is applied to the topically which is applied. It may be applied to the skin or nose or eye. Anywhere it can be applied. In this, first one is skin topical route of drug administration. The main mechanism of this route of drug administration is the drug is applied to the skin surface where it is absorbed locally or systemically. In this route, the drug absorbed by local or systemic. We already learned about systemic route of drug administration and the local route of drug administration. So this topical route is mainly focused on both. It may be reaches the for example, you apply the cream cream in the local surface of your skin, means the particular local action may be produced like antifungal effect. Otherwise it will reaches your systemic circulation by if you have any wounds, means you apply locally, but the through the blood vessels it will reach to the systemic circulation. So that this topical route of administration in skin, it may local action or systemic action. For examples are corticosteroid creams or antifungal ointments. In antifungal ointments, we are applied in local, but it may produce the systemic action also. The major advantages of this route of drug administration is localized treatment and also minimal side effect, because the minimum quantity is applied in the topical route. That's why minimal side effect, and also it is many time it will not directly reaches to the systemic circulation. That's why minimal side effect is there in this route of administration. And also it is the very convenient. There is no need for the skilled person to apply the ointment. Anyone can apply in the topical, so that this route is a very convenient and non-invasive method, because it is not painful treatment. You can apply directly to the skin, means it is not painful. There, however, there is some limitations are there, disadvantages are there. The main disadvantage of this route is limited absorption for systemic effect, because in topical route of drug administration only minimal quantity is reaches to the systemic circulation. In the injection parenteral route of drug administration, for example, you inject the drug in the under the skin or in muscles, it directly reaches to the systemic circulation, means it will reaches the maximum drugs absorbed. But in the case of topical route of administration, only minimum you applied or one, for example, you applied 1 gram of ointment in the skin, means only the small quantities 100 mg like that only absorbed through the systemic absorption. Others may produce the local action. This is the main limitation of this route of drug administration. And also in skin, many some drugs may affect the irritation or allergic reactions. For allergic reactions also, for example, you inject the antibiotics, means previously you first test by allergic reaction by in the skin. So these are the disadvantages of this route of drug administration. Okay, next one is ophthalmic administration, which means through the eye. The main mechanism of this route of drug administration is Drug is applied in the form of drops or ointments. It may be used by the drops or ointments directly into the eye. Directly into, you can see this picture. You can see this picture. In this picture, the ointment is directly, the drops is directly applied to the eye. This type of route of administration is known as ophthalmic drug administration. For example, atropine eye drops and other antibiotics are the main examples. The main advantages of this route of drug administration is direct action on the eye or surrounding tissues. Because if you take the any other route means it will reach us minimum amount or it will take the time to reach us the eye. But in the ophthalmic administration, direct action on the eye and surrounding tissues occur, and also minimal systemic absorption, because this is the topical route, so that the systemic absorption is minimal. The main disadvantages of this route is localized irritation or dryness. Some drugs or some excipients may cause the localized irritation, which means eye irritation is there for some of the drugs, and also dryness. Some drugs causes the dryness. These are the main disadvantages, and also patient complication can be difficult. Patient complication is also the difficult in this route of drug administration. Okay. Next route of drug administration is nasal route of drug administration. The main mechanism of this route is the drug is sprayed into the nasal passages and absorbed via the nasal mucosa. There is the nasal mucosa present in the your nose. That is the main absorption area in our system. In this route, drug is sprayed. You can look this image. The drug is loaded in the sprayer. The drug is administered through the sprayer. The drug is sprayed in the nasal, and this reaches to the nasal mucosa. The nasal mucosa absorb the drug, then produce the oxygen. Okay. In this route of drug administration, the examples for this route of drug administration: oxymetrazoline, corticosteroids, nasal sprays are available in the market. Okay. The main advantages of this route is rapid absorption is there, because this route reaches the directly to the nasal mucosa, means directly it produces the rapid absorption, and also bypasses the bus pass metabolism. Bus pass metabolism means we already studied. The drug reaches the portal circulation itself. It metabolized, like the drug does not reaches to the systemic circulation and metabolized, which means the bus pass metabolism. This route of drug administration is bypassing the bus pass metabolism, and also suitable for the systemic and local effect. This also suitable for the systemic and local effects. The main disadvantages of this route is irritation or dryness of the nasal mucosa, and also refound congestion with prolonged use. These are the disadvantages of this route. Then we can see about the other route of drug administration. In other route of drug administration, inhalation is the main other route. The mechanism is the drug is inhaled into the lungs like that. You can see the asthma sprayer like that. Um, the drug is inhaled into the lungs, where it is rapidly absorbed through the alveolar membrane. For example, salbutamol, oxygen, anesthetic gases are inhaled by the nose. It will directly reaches to the alveolar membrane in our lungs. The main mechanism of this route is the drug is inhaled into the lungs, where it is rapidly absorbed through the alveolar membrane. For example, salbutamol, oxygen, anesthetic cases. Advantages of this route is rapid onset of action, local effects in respiratory tracts. The main disadvantages is irritation to airways and also difficult to control dosage because in one stroke sometimes many drugs is absorbed. The, so that irritation and difficult to control the dosage is the main disadvantage of this route of drug administration. Next one is transdermal administration. The transdermal touch, the main mechanism is drug is applied to the patch on the skin, releasing the drug over a long period, like that patches. You can see this image. The patches is applied into the surface of the skin. The slowly the drug is released to the membrane. For example, pentylene patch and nicotine patches available in the market. Also nowadays insulin patches are we are nowadays developing and sustained release. Main disadvantages are skin irritation or allergic reactions limited to small molecules. These are the main limitations. Okay, thank you students. Today we are clear about the other route of drug administration and also the um, topical route of drug administration. Okay students, we can see in another video. Okay, thank you, bye.